Good afternoon, everybody. I hope you're enjoying AEF and the Digital Energy Festival so far. The next session is a digital dialogue hosted by Power Africa, titled Lights on Health, Powering Healthcare in Sub-Saharan Africa. I'm pleased to introduce Luke Saveri, Senior Energy Access Specialist at Sustainable Energy for All, who'll be moderating the session. Over to you, Luke.
Thank you, George. Thank you also to Power Africa for hosting this session. I would like to welcome all our wonderful panelists today. So with us today are Brian Wamala from the Clinton Health Access Initiative. We have Jody Wu, who works for Off-Grid Box. We have Ray Gorman, who works for the Power Africa Off-Grid Project. And we also have Lauren Thomas, who works for Electra. Today we'll be focusing on powering healthcare. We'll be focusing on this nexus issue between how do we provide reliable power to health facilities, with of course the goal being improving health service delivery, especially in energy deficit countries, so in countries that are currently experiencing issues and gaps in energy access as well as in energy reliability. For those of you who are quite familiar with this space, there are lots of little facts and figures that are floating around. Sometimes you hear 1 in 4 clinics is not electrified. That is a statistic that is perhaps slightly outdated, but still tells a very, very powerful story, even if it's not as stark as that. The most recent study, which looked at both low and middle income countries from, I believe, 2018, put the number at 59% of all health facilities lack reliable power. So that means there is a large group of health facilities that have either no power, so they're unelectrified. They are under-electrified, so maybe they do have a little bit of power, enough for a light bulb, maybe to charge a cell phone, maybe to run 1 or 2 appliances. There is also a large group, perhaps in some cases a growing group of health facilities that are unreliably electrified. So maybe they do have access to quite a lot of power, but it's intermittent, which of course is also quite detrimental to health service delivery. So today we only have 59 minutes left. I have this big red clock that's counting me down. So I know already, I'm going to go into this knowing we're not going to solve the problem today. But I do want to make sure that we learn first from each other. We learn from this great set of panelists. I encourage all of you, of course, to also be a little bit critical towards each other. Feel free to ask a question as well to your fellow panelists. But the first challenge that I have for all of you is, when we talk about a barrier that is holding back health facility electrification, also bring up a solution, please. And it doesn't have to be the biggest solution in the world. We know we have a lot of barriers in this place on data, on policy, on funding and financing, on appliances, on power solutions. But whenever you bring up a barrier, it would be great if you could also bring up, like, what are you or what are those around you in your network, what are we actively trying to do to improve on the situation? Because while globally we have seen that we are off track as it relates to just the general Sustainable Development Goal 7 goals on access, on efficiency, on renewables, we are making progress. I think that's the silver lining, and especially when we look at this nexus of health facility electrification, this is an issue that can be solved. This is an issue that can be solved by 2030. This is an issue that should be solved well before. We have an opportunity, one of the few that COVID-19 has provided us with, because we've seen, and we're still seeing, a big spike in interest, a big spike in momentum of organizations who previously perhaps were not looking at this topic, at this nexus issue, of trying to get this problem solved. Because of course, this is dating back to about 6-7 months ago. All we were hearing was ventilators, and we need power for ventilators, power for lab diagnostics. We need power for light to know what we're doing. Light was considered to be a PPE, and still is. Like, it's something that is critical to keep health workers safe. It is critical for them to be able to do their work in a COVID-19 world, as well as in a post-COVID-19 world. we are hearing increasingly concerns about the cold chain gaps that currently already exist that are just going to be exacerbated if and when a COVID-19 vaccine is available for mass rollout. So just to put like a little bit of a bleak cloud on all of this before we actually learn from all the wonderful things that our panelists are working on. Yeah, I just wanted to set the scene a little bit and make sure that we all understand what we're working up against, especially with, as I said, this increased momentum is something that we absolutely need to grasp, because unfortunately we have been here before, the collective we, just 6 years ago with the Ebola crisis, which of course was more regionalized, but brought up very similar conversations around like electricity for light, for wash, for treatment, and we weren't really able to grab that momentum and turn it into action. So it is the big challenge that we're all facing now, and I'm hoping that together we can already make again another, maybe small because we only have 55 minutes left, a small step forward today, and we'll start just by hearing from each of you, to keep it short, like 3-4 minutes. Briefly, just maybe very briefly talk about what your organization is doing, but I'm hoping that the majority of the audience knows what you're doing, knows what your organizations are. So just focus on like what are one or two really innovative things that you're working on that you feel is really pushing the boundaries and is making a dent in this space. And I'm going to do something that we typically also are not able to do, or are not good at, and that is starting with a health perspective. Like today, traditionally, we focused quite heavily from an energy perspective, myself included, because that's my own background as well. I think the panel is again skewed a little bit to the energy side, so we'll try to mitigate that a little bit by giving Brian from the Clinton Health Access Initiative the first word. So Brian, we'd love to learn, like, what are you currently working on? I believe the focus for today that you want to talk about is about Uganda, perhaps a little bit more around appliances, about the health space. So yeah, the floor is yours.
Oh, thank you so much, Luke. You've really given it justice. I think the lack of sufficient electricity across health facilities is significant in Africa. In Uganda, with almost 11,708 health facilities, just only 6% have access to reliable electricity for over 16 hours a day. And 14% of these public health facilities use other alternatives like diesel generators. However, we all know that over time, the price of diesel keeps going high. And sometimes in a low and middle income country, or a low and middle income country like Uganda, the supply chain uh, is not constant. So, despite the government's efforts to ensure that at least we have a reliable source of power throughout the country, uh, there have been some delays. For example, there have been lack of resources. Sometimes you find that as time goes on, government priorities keep on changing. So over time, we've observed that the key reliable source of power is solar. However, the initial cost of solar maintenance charges, and also understanding actual size that is required for an average health facility has been a huge challenge across the health sector. So in 2019, Clinton Health Access Initiative, as a trusted partner and an advisor to the Ministry of Health in Uganda, with support from Bill and Melinda Gates Foundation, we went out to 2 of our districts where we support to understand how can we work with the different stakeholders to address the issue of power within the health facilities. So we decided to use a leasing approach of accessing power at the facility. So what we did, looked around to see which key solar service providers can we use within Uganda and East Africa at large. So we zeroed down to one service provider who went ahead and did a situation analysis just to understand what would be the key requirements for any given health facility. So findings from this assessment showed us that on average, at peak hours, an average health facility would need around 3 kilowatts of power to light up the maternity ward and the outpatient ward, and also need around 0.5 to maybe 2.2 kilowatts for staff quarters. So this power can be used for lighting up the facilities, for charging phones, and also charging any device or medical device that a facility can have. So when we got these findings, we had to sit on a round table with the different stakeholders at both the national level and the subnational level to understand how do we ensure that all these facilities get access to power. So the government signed a memorandum of understanding with CHAI to provide access to solar power in 7 facilities within the 2 districts. So CHAI comes in, and our hypothesis was if we increase access to power at a health facility, we are sure that health workers will be able to spend at the facility. We also if health workers are at the facility for a longer time, other health outcomes will increase. For example, the number of children immunized will be able to increase. The number of deliveries happening at a facility will be able to increase. We believe that no mother should be able to give birth in darkness. That's one of the challenges that we've had within Africa. Like most of the times you find that health facilities lack power and mothers are giving birth in darkness. So if we come in and provide power, we believe that no mother will be able to give birth in darkness. So one may ask that then what is CHAI's value add in this? So like I mentioned earlier, the initial cost of power is high. So what CHAI is doing, CHAI is coming on to pay the initial costs, taking away the burden from the health facility, and also taking away the burden of maintenance charges from the facility to the service provider. Another thing, since the facilities cannot pay monthly payments, what CHAI is saying, okay, let's negotiate with the service provider so that we are able to pay on a quarterly basis. So we understand this may also not be sustainable in the long run. But what we are doing, we are telling the way we are looking at it, CHAI is going to pay the first quarterly payments in year 1. So as we do this, we are negotiating with the different stakeholders at both the national level and the subnational level, and these are the budget holders, to ensure that as we go into year 2, these stakeholders are in position to at least pay half of the quarterly payments, then CHAI pays the remaining half. So after that, we believe that the health facility will be able to take on this approach and fully pay for the quarterly payments. But we recognize that over time, the charges are high. So, and health facilities may not be able to pay a monthly payment because currently, even when you look at the quarterly payments, what an average health facility can pay over around 25%. So if we say the facility pay a monthly payment, it will be tricky and very complicated for the facility. So what CHAI is doing is negotiating with a service provider and saying, okay, the facilities may not be able to pay a quarterly payment. Are we in position to ensure that at least we move this to quarterly payments? So, and if we move them to quarterly payments, how do we ensure that we cut the cost so that in the long run, the facility is able to keep up with this and able to pay? So though we are looking at it, we are negotiating with the service provider again and saying, okay, we've done this with the initial payment. So for the long run, can we go on reducing the cost so that a facility can be able to maintain or can be able to pay for these quarterly power costs? So that done, we are optimistic that maybe even other donors, other partners can come on board and be able to provide power or solar power to the different facilities. Thank you.
Thanks, Brian, and it's great to hear about the leading role that the Clinton Health Access Initiative is playing right now in Uganda, but looking also at other countries. So because this is exactly the kind of interventions that we need more of, also just to learn lessons. And I'm building my own word cloud here on a piece of paper. You mentioned standards, you mentioned ability to pay, you mentioned costs and maintenance, like CapEx and OpEx. So I think these are the words that I think in the remaining time that we have under this session will keep on coming up. So because I don't want to speak too much, I'd like to just pass the floor now, the virtual floor, to Ray Gorman, because I know he has maybe a more a regional or a larger view on this topic, and has definitely been exploring what the state of play is in further detail. And yeah, Ray, what you have to share with us today?
Thanks, Luke. Thanks very much. And thank you, Brian, for an excellent introduction to what you're doing in Uganda. It's really exciting stuff. So as Luke rightly highlighted, COVID-19 has only exposed these challenges. These are long-standing challenges around healthcare electrification. For anyone who's been working in this space for a while, they know that most of the challenges that existed 10 years ago still exist today, unfortunately. But as Luke said, we need to focus on not looking back at the issues and looking instead at possible solutions for these. And possible solutions that we see are business models around those OpEx costs. And that's what we're really interested in, similar to what Brian was talking about. We think there are potential business models, private sector business models, let me be clear, because sometimes people consider business models to include donor-driven models, but private sector business models that can cover at least some of the operating costs in a financially sustainable way. We don't know exactly what those business models are yet. We're still exploring that. We're very excited to work with some of the actual other presenters here that we've given grants to. We provided $2.6 million of grants to 9 companies, trialing different business models in 9 different countries across sub-Saharan Africa. We're really excited to see the results of it and to share the learnings, because as Luke said, we need to learn from this. We need to generate more data, more information, more best practices, and it needs to be a collaborative effort. And just in the interest of time, I'll keep it nice and short and leave it at that for now.
Thank you, Ray. Points for brevity and for being very energy efficient with our time. So much appreciated. And with that introduction on the grants that were issued, I believe with Jody and with Off-Grid Box, we actually have a grantee on the panel as well. So yeah, let's dive straight in and see what's in store for Off-Grid Box. What is the current thinking on approaching this topic?
Yes, thank you so much, Luke, and thank you, Ray, for our funding. Just a little bit about Off-Grid Box to give you a little bit of context. We've been operating for the past 3 years, and we basically have a containerized solution that's a 2 meter by 2 meter by 2 meter cube that provides solar, that provides both energy and purifies water. So with Power Africa, we have this opportunity to electrify health clinics, and so for us, we go where no one else has gone, and this project has been just exactly that, of visiting different sites and realizing, oh, we can't get there by road. We have to go when it's not a rainy season. So in terms of implementation, there's a long process from start to finish. And with POP, they recognize that even though us as an organization, if they said deploy today, we could deploy our 6 boxes within 1 week. They know that there's a lot to do in terms of relationship building and really doing the right site assessments. And as Brian said, even sizing the power to the right dimension. So that begins with building the relationships with the Ministry of Health, going all the way down to district level, to village level, working with the district health, and really understanding the dynamics that are happening, whether the health clinic is unable to afford additional energy. One of the experiences that I can definitely, that I've already observed is a lot of these health clinics that I visited, and we visited about a dozen in the past 2 weeks, they actually already have solar, and all of them are broken. They either were hit by lightning They said, oh, we got this in 2006. They have diesel generators out there, and they can't even afford the fuel to keep it going. So there's definitely a lot of challenges when it comes to OpEx and CapEx. And I think there's an opportunity to figure out how do we start to engage. So for us, this next year is really going to be, some people would say the technology is deploying the technology is the end result, but it's actually the beginning of figuring out how do we engage the community and how can we ensure sustainability, including the replacement of batteries 5 years from now and 10 years from now, and really thinking about it in the long term. So thank you.
Thank you, Jody, and great to hear what's in store, because we often spend a lot of time, because it is necessary, of course, spend a lot of time talking about the issues and trying to coordinate between different stakeholders. So it's always good to hear about kilowatt peaks actually reaching health facilities, because that's ultimately what we need to achieve. So we'll keep our eye out definitely on the progress that you're making in the next couple of months and the next couple of years. So let's round out this this first round with Lauren Thomas, who works for Electra, who some of you may know more from a larger scale infrastructure, hydro dam, I believe. There's a wind products, like wind projects as well in sub-Saharan Africa. So Lauren, what brings you to the panel today?
Thank you, Luke. Well, as you pointed out, Electra's history has focused on grid development of large-scale projects. We've originated over $1 billion in clean power and transport infrastructure, and have a portfolio of about 360 megawatts generation capacity. However, Electra has also developed a solar mini grid project in Uganda that had associated road infrastructure and transmission, and has a proprietary solar module for off-grid solar electrification. And so we kind of attack the off-grid development model with slightly an on-grid mentality. And recently, as I think, as you pointed out, Luke, as a response to this drastic, immediate need for cold storage for vaccine distribution at rural health centers, we have transitioned our focus from electrifying rural consumers to electrifying rural health centers in the off-grid sector. Electra has been devising a portfolio of off-grid health electrification, which then allows us to structure a project that does kind of resemble on-grid in a way. So our innovation is less in the technology of the solar panels and more in the structure of the project and how it can be financed and realized. So some critical factors, which again will sound familiar to anyone who is in the on-grid large-scale space, is economies of scale, not scaling up over time, but designed from inception to have a portfolio, a central purchasing agency, possibly the hardest part of the equation, but it kind of follows on what Brian was discussing by taking the immediate burden off each individual health center and still places some responsibility of electrification of rural health centers on the health sector. However, there is a clear role for CHAI, for Power Africa, for organizations to then provide support that you can see even in the on-grid sector to these purchasing agencies or off-takers, if you want to use that word. And in that sense, you can provide guarantees, payment support, or direct tariff subsidies upfront or over time, which allow you to provide a modest market return that brings in the private sector. So this is something that Electra is in the early stages of developing, this kind of robust solution. As I believe Jody pointed out, there has to be maintenance, there has to be spare parts, you have to have it designed before before you roll it out, so that you can ensure that all these costs are factored into the tariff, which then back calculates kind of this role for the subsidies that can make this system realized. Thank you.
Thank you, Lauren, and thanks for closing the circle and really honing down on what is still the critical gap in empowering healthcare, which is figuring out how to do it well. Like, we know how to do it. Jody mentioned there, you go to a health facility, there are solar panels on the roof. We're not the first people, we're not the first organizations to think about, oh, what about distributed solar to provide power to these clinics? If anything, we did some energy audits a while back in a handful of countries, and in some clinics you can find 5, 6 separate small scale solar home systems. The majority of them are not working. Like, we actually are sitting a bit on a graveyard of solar panels on the rooftops of our health facilities. So it's less about the technology, and I'm actually pleased that none of you have really brought up the fact that, we now figure out how to provide power to these clinics. We know how to do it. We know how to do it. The distributed solar space in particular has made gigantic leaps, especially on household electrification. So the big question now, of course, is what lessons can we learn? Which parts can be replicated and which parts can't? To also make sure that we get all our health facilities, but equally all our schools, all our other public institutions electrified. So I'd like to pick up on this a little bit further and maybe pass it back to Jody from the private sector perspective. We know that this is not necessarily the most traditional business case for a private sector actor. So I'd like to basically ask, what would make it an interesting business case for a private sector actor? What are some of these elements that would need to be met or that would need to be in place, be it from on a policy side, on the data side? Clearly funding and financing is another aspect, but what for you would be the key driver to get yourself to expand your activities, but also to get all your competitors in the space? Because that's exactly what I would love to see, even if that's not necessarily what you're looking for. Jody, over to you.
Yeah, so I think what's probably interesting and unique about off-grid box is, in essence, our box is actually oversized. We have developed our technology to basically serve the future of energy. Our primary business and how we operate in Rwanda and actually across East Africa is really around how can we generate revenues from our box. So we actually sell water to the communities in which we serve, where there are actually massive water issues. So not only are we tackling the energy issue, but we're also tackling the water issues, which is, I guess you can say, the other essential to life and productivity. So for our box, this project came perfectly in the sense of, we realized our energy was perfectly sized to serve the different clinics. Going into these clinics, we found that there was all of this donated equipment that had never ever actually been used, or that this equipment would only work if they turned on the generator, or if only one machine in the entire clinic was turned on. So it's definitely a challenge, and sort of this, you can say the health centers actually have almost a better knowledge of energy in the sense of they realize, okay, I can only use this infant warmer during the day. So I think in terms of different models, like for us, already we're trying to do that. So for instance, with our boxes, we're not just deploying the technology, we're actually deploying it with a business model, with someone who's actually there full-time doing the maintenance. So providing power not just to the healthcare clinic or health center, but also to the community, where we provide what we call the walking grid. So if someone wants to rent a power bank, someone wants to charge their phone, they can come to the box and get services. And we found that water, it's just really sad of the case that our clients face is either water from a source where they don't even like the taste of the water and it's not reliable and requires boiling and all these other environmental factors that don't help with the climate change. But that allows us to provide more services using just a tiny bit of energy. So we're trying to be really innovative of, like, how do you get more returns on the investment And how do we actually use the technology we're providing for the health center, not just for the providing technology for or powering the technology, but also having it as a resource for even the community outreach. They usually have a community outreach person where they can teach about WASH, and they can teach about energy, and they can teach about the sustainability around all of that. So I think it's really around how do we engage all the stakeholders, how do we really collaborate. Already, one of the changes that we're already looking to do, and I guess Ray, you'll hear about it soon, is like we were gonna get like the best vaccine refrigerator on the market, and then it just occurred to us, it's like actually, we need to get the vaccine refrigerator that the Rwanda Biomedical Center is providing to the entire country so that there's after sales, so that we as energy experts don't have to become the medical device experts and not know what to do 2 years from now, 3 years from now, 4 years from now. So we're already engaging in different ways, and I'm really excited about the different business models that we can start to pilot. And that's the kind of flexibility that we have, whether it's selling water, running a canteen, any of it. So that's really what we're having, is a hub of energy that sort of provides endless possibilities.
Thanks, Jody. And staying at the clinic, Brian, what is the current state of play on the appliance side? Because it's, again, like providing power to a clinic is pointless if there's nothing to power, or if the health facility staff doesn't know how to operate certain appliances because they were donated in the past and then they're still in the box, or they're not energy efficient, which means like even a quite robust solar PV solution is not able to really power, for example, equipment to sterilize, for example. So what has been your perspective to date on, or from your findings from your research on the appliance side, especially looking at a typical health facility?
Thank you, Luke. Increasingly, there have been a lot of challenges in the health sector, and you talk about appliances. That's one of the challenges that we've had over time. When it comes to immunization, we want to increase the number of children immunized. It's important that we should have fridges. So the way we had looked at was how do we leverage the programs that we have within the country, because we, as CHAI, we have a couple of programs ranging from malaria, HIV, immunization. So how do we leverage these programs to ensure that we identify facilities have fridges, but they're struggling. We identify facilities which have microscopes in place, we've trained health workers on how to use these devices, but the power is still a challenge. So one of the key things we've done is sensitize and train health workers so that if these equipment, we get, they're able to use the equipment as well. But still, we are fundraising, or we are reaching out to the different potential donors, and also negotiating with the government to ensure that some of these basic equipment that are needed in an facility are around. Thank you, Luke.
Thanks, Brian. Ray, I'd like to pass this virtual baton back to you and just hear a bit more, because you do have a wider perspective on this as well. Just given all the research that you've done in this space and your familiarity with it, what are you currently seeing in terms of promoting service-based models, or the role of the private sector in actively addressing some of the problems that we've seen in previous interventions?
Thanks, Luke. I think it's very relevant that donors are increasingly recognizing the potential role of involving the private sector if they want to guarantee long-term financial and operational sustainability after the end of their project. And that's key, and that's the first step. In terms of what those business models look like, we're not seeing convergence yet. There are some common traits we're seeing, such as energy-enabled services that can generate additional revenue just like was spoken about by Jody, and actually is a similar model that Lauren's organization implements on their mini grid in Uganda. That model is emerging. However, I think it's too early to definitively say which one will work. This is why we've actually given funding to diversity of business models to try and see what is working out there. And we don't even guarantee one of them is going to work. We don't know. This is something new. This is a new area. But it is really reassuring to see that the private sector have an interest in this, and that donors and governments are increasingly willing to engage them. We think it can improve and increase. Everything always can, but we think it's a good step.
Thanks, Ray, and thanks for pointing out that context matters. I think that's another big part that the audience needs to always be aware of, and we shouldn't necessarily assume that we will find one model that is scalable in one particular country to target every health facility and is also replicable for every other country that is facing a similar problem. So, Lauren, how does context matter for your interventions? Because, of course, you do have experience also looking across different countries. What would allow you to replicate what you're currently doing in Uganda in another country, for example, perhaps even a country that's, let's say, not comparable to Uganda? So how would you replicate this in, let's say, in Senegal, which is still facing this problem?
Sure. So there are currently data gaps that Electra is trying to solve as we think about how we can apply our solution to additional markets. And by that, I mean, what is the correct energy solution for each rural health center that allows it to bring in the correct catalog of equipment and grow its services. So the first question is, what are the priority health clinics? I know there are a number of national registers and lists, but just as an empirical example, in Mozambique, we reached out to a specific district to request their list of priority health centers, and they gave us 3 centers that were not on any national register that we could find. So we started to write letters to get introductions, to start asking questions, and this type of work really does benefit from having boots on the ground. I think Jody and Brian definitely agree with that as well. What is the load profile of these clinics, and not just now, what will be the load profile when they have the additional equipment that will allow them to reach an additional base of patients and provide additional services, particularly vaccine storage. Using that load profile that's been modeled out, what is the right technology or the right combination of technology? So the Solar Electra, as we call our own solar module, is something that is modular and can be sized up or sized down for the different load profiles of clinics. And so kind of having this understanding of where the clinics are, where they should be, it allows us to size the right solution for each clinic, and then of course within each market.
Thanks, Lauren. And just to briefly highlight to the audience that you do have the opportunity to ask us questions as well. And in a little bit, I'll try to bring on some of these questions as well and ask them to the panelists. I think to date, it's so far in this panel, it's clear that we're seeing challenges, and we're all trying to address them. We're trying to address them in our own way. Clearly, the business model side, the delivery model is the key one that keeps on coming up. I do want to not neglect the point you raised, Lauren, about data, where I'd say if we had this conversation a year ago or 2 years ago, when we mentioned data, it would have been all around impact data. We need impact data to understand kilowatt hours, life saved. Like, what is the pathway? How can we prioritize this issue? COVID-19 has kind of taken care of that for us as a sector. Electrification of health facilities is increasingly being at least acknowledged as a priority. But now we have this different type of data that we're lacking, or in some cases even worse, we have wrong data, or we have data that's like quite outdated in terms of like, where are these health facilities? Do we actually know which ones are close to a mini grid that could be extended? What is the current state of play of these health facilities as it relates to their energy source? You know, what is the appliance state of play? And like I'm looking at Brian here as well, because without that aspect, you can only answer half of the question. So it's, before we talk a little bit further about appliances, this is an open question to all of you. How are you tackling the data issue, especially at, like, with a larger mindset? Like, what do you see that is perhaps quite promising that we could end up in a situation a year or 2 years from now with a global registry of every health facility with exactly which power source they have, when it was installed, who installed it, etc., which is perhaps a pipe dream, but how can we get closer to that? Or what do you see in terms of like initiatives, perhaps more at the national level, that at least are coming close to that?
Look, Brian here. So one, it needs ownership from the government, because you realize that you move around the different facilities, you find different providing power to at a couple of facilities, but people at the national level are not aware of who is providing solar, where is it coming from, which sort of assessment did they do before they provided solar. So the government coming up to put together different policies on how to do this, it will guide us, also streamline our data moving forward. That's my understanding so far.
Maybe over to you, Jody, then. Like, what kind of data are you now trying to collect at this point to prepare for your intervention, as well as what kind of data are you really looking to create from this type of intervention that hopefully, like, and what is your audience for that type of data?
Sure. So I think from the data side, there's multiple layers to it. As we look at energy overall, it's really important that we get the national data from terms of the national electrification plan. Where is the energy group going? Where are the next places they're going to electrify? But also going to the ground in terms of how long has it actually been in the plan for those locations to be electrified. So it's really about balancing it, right? You can't just take data from the top who don't know what's happening on the ground, and you can't just take data from the ground and not know what's in the national plan. As Brian said, it's really important to work closely with the government. To give a real life example, our original health clinics that we wanted to electrify, we found out they were on the list of priority health clinics, but when we went there, they're actually already electrified or had gotten donations of a solar system, and we were like, we can't electrify clinics that already have power. And so what we've seen is the 2024 electrification plan of 100% of Rwanda is actually moving very, very quickly and very, very aggressively. But also at the same time, the Ministry of Health is doing really innovative things in the sense of every health clinic, there's a health clinic in they call them health centers, in every sector, which is a governing level. And now they're looking at second generation health posts. So what are these village level locations that are serving 2 or 3 villages that can now be upgraded to provide lab facilities, to provide maternity care, to provide dentistry? And this is something that even some of the districts we went to were not even aware of the program. So we had the Ministry of Health share their secret plans. And so it was really exciting to see that this is the future, and we wouldn't have known about it if we weren't working closely with the Ministry of Health. The other aspect of data is, I think as you look at all energy companies, especially with us, one aspect that's becoming very important for sustainability and I guess longevity of the project is really around the remote monitoring. So what data can we collect around usage to know that our system is actually having an impact? Are people using it? Are they overusing it and we need to upgrade the size? So we see remote monitoring as a great way to harness knowledge from all of our boxes everywhere And I think the neat aspect, or where it becomes much more interesting, is how can we connect the data to the lives it's saving, to the number of more people who get more vaccines. But the tricky part is that's sensitive information. So how do we bridge that gap to really quantify the impact of energy overall?
Thank you, Jody. Ray, from your research in this space, where do you see the biggest gaps in the data?
Can I just say everywhere? I mean,
yes.
You can look at the report by SETI that says that there's been 21 academic studies on health electrification over the last 20 years. You can look at the lack of health impact data, as you highlighted. COVID gave us a case, but we could still do some more research in that area. I think there's a huge lack of quality data on health electrification rates. And when I say quality, I'm not just talking about the currentness, which as was raised, which is very important, obviously, but also the specificity. So currently it often is, it has electricity or it doesn't. It doesn't specify what level of access they have, which is very important. There have been proposals to apply a multi-tier framework to health electrification, similar to as we do in the solar home system and mini grid space, which I think is a very valuable approach. And as Brian mentioned, ownership. These things are useless if they are not maintained long-term. If the data is just once and done and you just walk away and no one will maintain ownership long-term and keep it updated, then its value is very much limited. Yeah, I think that's my 2 cents on that.
Thanks, Ray. And yeah, exactly. The gaps are everywhere. It's a really nice response. Even though it kind of, yeah, it's the stark truth that we're not really where we would want to be or where we need to be to fully be able to address the other barriers on funding and financing, which is what I do want to spend the remaining time on. Is and maybe we can start with Lauren. Especially given your the capacity and the experience that Electra has in basically carrying out like large deals, like big amounts, big infrastructure projects. You basically already mentioned like aggregation of facilities as well to be able to get to a certain scale to make it interesting. But like where do you see the balance, or where do you think the balance needs to head towards grant capital, concessional capital, public funding, financing, as well as private capital to be able to actually scale this up to the next level?
Right. Well, there is a role, I believe, for all of the stakeholders that you just mentioned in your list. So what you'll see in the on-grid space, and I think is entirely applicable to the off-grid space, is you will see project preparation funding, which applies essentially higher risk capital to the development, the structuring of a project. So it can be the structuring of the off-grid electrification of a portfolio of health clinics, and that funding can come from donors and then can be repaid at financial close, if you call it, the bringing in of the actual investors that will finance the portfolio of equipment as it gets rolled out. And the structure of that project can be such that there is a modest return to a private sector investor. Obviously, we're talking about more probably patient capital investors or concessional funders with longer tolerance for return on investment and lower market returns. But there are revenues that can be generated from these units, so there can be a return. Now, what you also see are tariff subsidies. You can see programs structured to already lock in a market tariff, or you can see the tariff subsidy in the form of a grant that is essentially backed into by what is that grant amount that is required for this project that will allow us to bring in the investor who gets their modest return close in on this upfront or ongoing grant that can make a reasonable market tariff that is accessible for the purchaser, which in this scenario would be a health agency. So you have, all stakeholders have their role. Everybody benefits, but there is quite a lot of upfront work in the planning and the structuring. So, you're not really just diving in and trying to do one and then scaling it up. And that's why we're still, modeling it all out at the moment. But it really does resemble the on-grid system, which has been tried and tested and proven successful over quite a number of years now.
Thank you, Lauren. And as a quick follow-up question to that one around, maybe not around funding and financing and how and when the capital is structured, but just general de-risking mitigation or risk mitigation mechanisms, what kind of role would they play to make this a more appealing space, either for the private sector actor or for the specifically the private capital that they are looking to raise, as well as who would have to play that role? Like which agencies currently have the opportunity to de-risk basically the scale up of these types of models?
Well, I think we can see a role for Power Africa or even a financing organization such as a DFC or other organizations such as the Clinton Health organization that can accept to outlay some capital, which can then in large part be returned to them with the deployment of the equipment financed by different organizations. In that sense, their capital can be recycled to continue to fund new portfolios. I would expect, or at least what we're seeing in our structuring, is that a portion of the funding would then not be repaid and stays outstanding as the actual tariff subsidy to be amortized over time. And so that is kind of how we see this system working, whereby there is some capital put up front that de-risks the project, but then is returned and allowed to continue to finance or de-risk additional projects as they advance.
So like a first loss fund or a revolving fund, essentially, that's able to mitigate some of the risk involved with deploying potentially high risk capital. Jody, when we talk about de-risking private sector involvement in powering healthcare, does that resonate with you as well? Like what Lauren kind of laid out?
Yeah, I think definitely when you look at healthcare already, a lot of it is not private sector funded. It's not debt financing. It is the world of healthcare is a basic need and a basic right of people, and a responsibility, or one of the main responsibilities of the government is to ensure the health of its people. So I think being really creative around how you engage all the stakeholders is really, really important in terms of how do we build in. I know, like, from when we had applied for our grant and I went to the Ministry of Health, they're like, is it free? Is there any payments that we're going to have to pay? Because that's the first concern that came to their mind, is we don't have the funds to do this at all, any kind of maintenance, anything. And so for us, we realized that was going to be a really critical component. So how do we commit to the next 20 years providing light for this health center? And what will that involve? But the hope is that we can develop those models where, yeah, the OpEx and the batteries to keep it running for 20 years or 100 years is already in place. And then I think it also just, this is a new sector. So new sector means investment and trialing things, failing fast, learning fast, and sort of how do we bring our learnings together? And then I guess the last thought that comes to my mind is, as we look at health centers and as we look at energy, it really is this cross-sectoral world. It's talking about water, it's talking about health, it's talking about energy, and how do you get these ministries to work together? How do you get private partner to work together? And so I'm very fortunate to be working in Rwanda, where the government is very engaged. And I think that's a privilege that I'm not sure how you do it in other countries, because I didn't have that experience before. So I'm very excited to be seeing what we can do and what we can experiment with here.
Thanks, Jody. I think that kind of leads me to a last quick topic that I do want to touch on, which is national prioritization and the enabling policy environment. You mentioned that you're basically grateful that you're able to implement this in a country like Rwanda, which has very ambitious targets and is actually making very quick progress towards them as well. Brian, in Uganda, what are you currently seeing, especially from like a national policy perspective? That makes you hopeful, as well as like what's perhaps the area that you think like, this is the next one that we really cannot neglect at the national level to allow organizations like CHAI, to allow energy access private sector actors to take that next step into powering healthcare.
Thank you so much, Luke. Just like Jody said, it's very key that we, first of all, organize ourselves at the national level. Uganda, I think 2 to 3 years back, we had challenges of how do we put together a program within the Ministry of Health which can support electrifying not only health facilities at the national level, but also at the grassroots. So what we are looking at, if we have an organized way of doing things, if we have a way how at the national level the different ministries can work together to put together policies, we'll be able to move to the next step.
Thank you, Brian. I have I have 2 eyes on the clock. We're into the last 5 minutes. So what I would like to do is in 5 seconds, basically take out one question that I've received here from the audience, which is, have national lockdowns disproportionately affected those who already struggle with energy access? Because it's the easiest question. The answer is yes. And it's not just the people who have struggled, it's also the organizations who are trying to solve the problem who are struggling. We see a lot of energy access companies really struggling today because, you know, with cash flow issues, because their business models do depend on, you know, like slightly high risk strategy of ensuring that there are very high repayment rates, of ensuring that there are no defaults, in continuously building and expanding the portfolio of products and of clients. So yes, the sector is definitely struggling, is not where it needs to be for us to solve SDG 7 or for us to address powering healthcare. So I felt like I tried to bring a message of hope into the last into this hour, but that question prompted me to make sure that we don't forget about urgency, especially on powering healthcare. It is so critical that we figure this one out, and we don't have 10 years to figure it out. Like we shouldn't assume that SDGs like 2030, that's our end goal. We need to figure this one out sooner. So with that in mind, I'd like to just give all of you like a short minute to just give like a little closing statement, maybe like what is your one hope or your one recommendation that you really want to see happen in the next moment in time. So in the next month or in the next year, that you say, if we can get this, then I'm hopeful that we can get it done by 2025. And just randomly, let's start with Ray.
Thanks, Luke. I'm going to focus on your message of hope that you were talking about. I myself, to your data question earlier, was very cynical about all of the gaps we have. I think that cynicism is possibly somewhat misplaced. I think there are some great examples of great literature out there, such as the FE for All Lasting Impact Report, the Powering Healthcare Toolkit that's hosted on the USA website, etc. There are efforts going on in this area, and there are some concerted efforts that are very collaborative, and a lot of really innovative ideas coming out of the private sector. I think we have a chance to crack this, but we just need to keep on pushing forward, be as collaborative as possible, and share lessons. Yeah, that's it for me.
Thank you, Ray. Lauren, do you want to take the next one?
Sure. Well, as a representative of the private sector, I'd say that the private sector is well equipped and eager to tackle rural electrification of off-grid health centers. I think, as we discussed before, the need for assistance in de-risking the initiative for the private sector, which means all of the attention that the sector is getting by Power Africa, Clinton Health Organization, and other players. And obviously, what Jody touched on is that there just has to be some buy-in from the health sector as well. They do have to acknowledge that possibly with subsidies, with guarantees, with all the support that they may get right now, this is the time for them to take on some responsibility to provide some economic support for the health centers in their respective countries.
Thank you, Lauren. Jody, do you want to go next?
Yeah, I think what I would add, I'm echoing Ray and Lauren's comments. I think it's really important as we look forward and we start to develop these models that we don't forget who we're trying to serve. The people who are going to benefit from our technologies are the community itself. It's the doctors who are going to have to use our products, use our energy. And so really, how do we evolve them in that design process as we start to explore different business models? And how do we customize it to the context? Because we say every country is different, but also every village is different. So how can we be more sensitive and more innovative in how we approach solving these problems, whether no matter how unique it is?
Thank you, Jody. And we started with Brian, so let's end with Brian. Make sure that we cap this conversation with a strong health lens. So Brian, what's your message of hope and urgency?
Alignment of the key stakeholders, government ownership of the processes that will ensure that no mother gives birth in darkness, and every child will have an opportunity to live a good life. Thank you.
Thank you, Brian. Thank you, Lauren, Ray, Jody. Also, thank you to Power Africa for organizing this and for giving us all a platform to share some of these thoughts, some of the lessons, some of the failures, as Jody mentioned, that we, as long as we learn from them, it's okay. It's okay to fail. It's okay to fail, as long as it generates the right level of data, and make sure that next time we even if we don't get it right, that we get it better, that we try to just always improve on what we've done in the past. And with that, I'll conclude this very engaging hour. As I think all of you can tell, we could have used about 5 more years to talk about this conversation, but we're going to keep it to an hour today. Stay tuned. There are many more interesting conversations coming up. But with that, I would like to once more thank all our panelists, thank Power Africa, and I hope you all have a wonderful rest of your day. Thank you very much.
Mambo.
Nyanvuseli.
Ohoro wako.
Thobela.
Hello.
Sawubona.
Yoga.
Oliot. Bote. Agan. Mulembe.
Kamelacha.
Welcome to Africa, a continent bursting with life and industry. It is our passion for progress that is powering Africa to the future.